17 Americans and a dual U.S. British citizen are back in the U.S. after being evacuated from the cruise ship at the center of a deadly Hantavirus outbreak. 16 were taken to Nebraska to be observed and quarantined. 2 were brought to Atlanta. U.S. officials confirm at least 1 person has tested positive for the virus. That person remains in biocontainment. Health and Human Services Secretary Robert F. Kennedy Jr. said the U.S. has the situation under control and the administration is not worried. Roughly 150 people were on board the MV Hondius when the first patient got sick. Passengers started disembarking Sunday morning after it docked in Spain's Canary Islands. The ship set off from southern Argentina 41 days ago. Let's bring in CBS News chief medical correspondent Dr. Jon LaPook for more working overtime today. So what is the latest today, and why are officials worried about this incubation period?
You know, the whole thing about the incubation period is if somebody is exposed and they get infected, at any point in the next 6 weeks, they could get symptoms. And we know from previous outbreaks that, this virus, this Andes strain of Hantavirus, was first identified about 30 years ago. So we know about it. The time when people are most contagious is when they first get symptoms. So what they don't want to have happen is somebody gets infected, they fly back to whatever little town or big town they come from, and they suddenly develop symptoms. And it could just be low-grade fever and sort of not feeling well. They think, I've got a cold, maybe I have the flu. And they expose a lot of people to this virus, and they infect a lot of people. So what happened here was we learned that somebody tested positive at some point, as they were being flown from the ship to Nebraska, we learned that somebody tested positive. Now, if it's not a false positive and real, you say, wow, that is an example of public health working. Because had they just brought the person, in a regular airplane without any protection, they could have infected other people on the plane. But what they did was they put them that person, I don't know if it's a man or a woman, in a biocontainment pod. Remember when we had Ebola, they had those to try to protect people in flight. So that's an example of when public health works, nothing happens. And people sort of don't celebrate, right? When the 11-year-old girl falls off a bicycle wearing a helmet, doesn't get a skull fracture because she's wearing a helmet, nothing happens. Somebody gets immunized against diphtheria and they don't get infected, nothing happens. So you're looking in public health for nothing to happen. And so far, this is a good example.
Well, I love what you said on CBS Mornings today, which is this isn't just people telling you to believe this. You're looking at the science. And a lot of people on social media, all the comments, they're thinking, OK, this is the next COVID. This is not the next COVID, right?
100%. OK, so what is reassuring to me is not I like that the WHO is saying it's not going to be the next pandemic. I like the CDC is saying it. But what I'm reassured by is the whole public health effort and the science. We understand the underlying science here. This is a virus that we know about. And so I don't have to take somebody's word. I've read the whole literature now. I mean, there isn't that much literature. And I am convinced by what I read that the risk of widespread dissemination of this is very, very low. Why? So COVID was a virus that we had never seen before. And as it turned out that it can spread across a room and infect somebody, especially with poor ventilation over time. This is basically spread rat to rat. Yes, it can jump through probably droplets in small, relatively short distances to somebody else. And that's how it would be spread person to person.
But it's dry environment.
In a dry environment. Well, it originally gets the rat. It occurs in a dry environment. I want to clarify that. So it's rat urine or saliva or feces in a dry environment. That's where you get the rat getting infected and infecting somebody else. But once a person is infected, it doesn't have to be in a dry environment to spread it to somebody else. That can just be, in the air through a droplet. And the big thing that people were worried about is, what if it spread across the room, to somebody that we don't realize that it could be spread just like COVID? And it turns out from what we know about it, you always have to stay humble and say, have humble if things change. But from what we know about it, that this virus doesn't do that. So I feel comfortable, not just because I'm being reassured by somebody, but because the underlying science says, this is not going to be like COVID.
Dr. Jon LaPook, thank you.